The hardest thing about thought field therapy is not eliminating stress, anxiety, trauma, or depression. The hardest thing is what we call the apex problem. And the apex problem is fairly common, particularly with people who have never experienced it. It is that when the patient will accurately describe what actually happened, they said, you know, just 2 minutes ago thinking about this, I was a 10. I was just really distressed about it. And now I just can't get upset about it. It's just gone, you know, easy peasy. But they cannot give credit to this simple tapping technique for what happened. I had a very interesting case. I was at a booth at a health fair here in town a few years ago, and this elderly lady walks into my booth and requested a demonstration right then and there. Now, she was really, you know, stooped, and she was obviously in a lot of pain, and she told me, you know, I have all these conditions, and I have all these diagnoses, and life is really tough. And I said, you know, I have no idea if I can help you, but why don't we take a few minutes and tap? And we did. And she said, you know, it's not really working that well. And I said, that's okay, let's just keep doing this. And she starts going like this. She says, it's funny, I just feel like dancing now. I said, okay, great. You know, it's really funny because I feel like going home and locking myself in my bathroom and dancing in my bathroom, because if I didn't lock the door, my husband would see me and he would think I'm crazy. I could not make this up, okay? This is, this is really what happened. And within 10 minutes or so, she walked out of the booth completely straight, her breathing normal, her face actually with color, her eyes sparkling. And it happened to be that there was a medical doctor just across from me, and I asked her, you know, could I just share what we've done here with this doctor over there? And she said, yeah, of course you can. I will go over there myself and tell him how useful this was. I said, oh, that's okay, you know. So I went over to this guy, and he said, you know, did you just see what we did at the booth? He said, yeah, she looked horrible. This is a medical assessment. She looked horrible when she walked in. I said, yeah, you know, this is fibromyalgia and fused discs and OCD and depression and, you know, there's all these diagnoses. And I said, wow, that's amazing, yeah. And I said, yes, this is quite something. But the point of my story is, when this lady started to do her wiggling and her dancing, she said, you know, I think I'm starting to feel so good because of your pink jacket. I love your pink jacket. And I start saying, you know, maybe I should have a booth selling pink jackets, and people just put those on and walk all over town with them, and everybody would be happy, and we would be rid of all our problems in the world. Hooray! And she said, okay, maybe that's not it. But she could not make the connection that what we were doing, literally in her face, for 10 minutes, had anything to do with her suddenly feeling better or different. It's called the apex problem. Very common if you experience it today and you start going, well, you know, I've done so many years of work on that issue. And I say, yep, and in the last 5 minutes, it kicked in. Isn't that great? And, you know, I'm not denying that what you have done over the past was not valid or valuable. Life is a series of steps. There's never a finish line. It's just one healing experience, and then we live life again, and the next one comes. And if you want to go through that next burden or hurdle a little more smoother, a little more gentler, then you may want to look at what thought field therapy has to offer.